So welcome back to See the Stories. We're still talking about monkeypox virus and still with our Dr. Randy here in the studio. So doctor, what is the treatment for monkeypox patients? I mean, from the severe one or the mild one, what are...
Like, let's say from chickenpox, we heard from our parents that you cannot scratch it or else it would actually spread all over your skin. And you know, you can't really going out, getting some air on your skin, stuff like that. So how about monkeypox?
So like I said, there's two diagnoses of the monkeypox, the mild one and the severe one.
Yes.
If it's only the mild one, usually isolations, of course, because it's, you know, close contact may make other persons get infected.
Can you do it at home?
Until now, we can do it at home because from the health minister of Indonesia was, you know, the last meeting with the doctors, you know, having patients with monkeypox. They isolate themselves in the house and then they will be a doctor from the Vaskes one. You know, BPJS have the Vaskes one or the primary health center in around their area.
That's for health perimeter in some certain areas.
Yeah, they will follow up the symptoms and the doctors will give the painkiller, of course, the most important. And then sometimes we give also the medicine for the gastric problem. Because sometimes they have dyspepsia. Dyspepsia is like gastritis, you know, like they want to vomit and everything else.
Is it like acid reflux?
Yeah, acid reflux like that. And then the fever, of course. And then the doctor usually, the doctor usually prescribe the creams for the lesions to make sure there is no secondary infections.
I mean, if we look at the picture now that are shown on the screen, it looks like a pimple to me.
Okay.
I mean, how do you
So
defer
there it
that
is.
from?
There it
how
is.
do you defer that from other, you know, problems with skin?
Okay, the first one, it is very painful. The pimples are not supposed to be very painful on the scale of 7 to 10, right?
Yeah.
So this one, we touch it and then the patient said it's very painful.
Okay.
And the second one...
Let me touch my pimple.
No,
It's not.
It's fine?
It's fine. It's
Okay,
fine.
good.
So you need to go to the dermatovenerologist because all of the skin lesions or diseases, it looks like the same. But the dermatovenerologist usually can, you know, make sure that this is this one or that one.
And with the temperature.
And with temperature and
any fatigue or any...
The lymph node enlargement, usually very typical. That makes difference with the chickenpox because the chickenpox rarely have, you have the lymph node enlargement, but not all of them.
Any muscle sore?
And the muscle sores, yes, because they feels like very fatigue, like feverish, like all of that symptoms. And this is like what I said, because in the first two days, it looks like a general pimples, right? In the first 2 days, it looks like just redness. So we don't know. Usually, I need to monitor until the 5 to 7 days to the arrow. You can see that.
The arrow, 7 days will do...
the black crust, the one like in the middle. That is very typical for the monkeypox. This is coming from the health minister of Indonesia. The last time we got the meeting with the cases of monkeypox.
Wow.
So don't worry if you go to the dermatovenerologist. The doctor dermatovenerologist will check it for you and things like that. And the second is the severe one. However, the doctor usually need to give the antivirus. A special antivirus that will be given is the tecovirimat. The name is really hard. It's tecovirimat, brincidofovir, and acidofovir for 14 days. However, in Indonesia, it was limited only for patient with high risk, which is the immunocompromised, the patient with HIV, patients with pregnancy, and then patients with high risk of, having mortality. We give that. But since in Indonesia, only the mild case being found, so until now, it's very rare.
Well, God forbid that we have any severe cases, but these are actually the suggestions of the treatment and also self-care and prevention that can be done for monkeypox. So most people with mpox will recover within 2 to 4 weeks. So that is actually the common duration.
Yes, the common duration. If you have the chickenpox in 7 days or 10 days, it will be resolved, right?
Yeah.
Your license is going to be crusted and then it will fall off in 7 days. But monkeypox have a longer period of times of having this painful crust. So they will take 2 to 4 weeks, stay home, and make sure that no family member get infected also because it can infect it through the droplets, a big droplets, not airborne. Wash hands and also wear a mask if you have patients in your house.
And will vaccine help?
So here's the thing about the vaccine. In United States, the vaccine is already being given for persons with high risk. So the vaccine being used in the United States were the Jynneos. The Jynneos was being used. But however, in Indonesia, the vaccine were still in, it's still being
in development,
in discussions.
In discussion, not even in development. It's in discussion.
It's still in discussing whether the health worker needs it right now or what. I mean, like probably wait and see because, according to the World Health Organization, this monkeypox is, a very low risk to be an outbreak of global like the COVID.
Okay, but according to World Health Organization, is it suggested for health workers to be vaccinated?
In United States, yes. The health worker, persons with high risk, like persons with HIV, persons who men who have sexual intercourse with men, they usually suggested to have a vaccine. So the vaccine, there are two main parts, which is the pre-vaccine, so before you get a monkeypox, and also post-exposure prophylaxis. So probably if we have a family member who have a monkeypox, we can vaccine to make sure that we prevented to get the monkeypox infections. But however, only 4 days period.
Only 4 days.
So if you have more than 4 days, the protections is very less.
Okay, so in this discussion, we found many medical terms when it comes to monkeypox, and I don't know if I could remember all these.
There's not going to be a quiz, don't worry.
And if Alia could also remember this, because our friend Yani will challenge us to answer myths or facts about skin health, and Dr. Randy will explain the answers. So,
okay, let's call Yani.
We will invite Yani.
Hello.
Come over.
Are you guys ready? It's not a quiz, but I mean, it's a game, right?
All right.
So it's slightly easier, I guess.
Okay. So this is actually our tradition, Doctor.
Yes.
So
I like to play games. We have guests.
after each discussion, we will play games, and usually the victims will be us.
The victims are us.
It's not going to be you. So let's say
it's really easy. It's fact. I'm gonna state a sentence, or it'll be a fact or a myth, and then you will explain. Just elaborate some more. But before we start, can I just say I love your kicks?
Oh, thank you.
Okay. Definitely.
From one sneakerhead to another, of course. The highlight would be the kicks.
Dr. Randy is very stylish today.
Thank you so much. I love your heels also.
Thank you so much. All right, so we're ready?
Yeah, I'm ready.
Yeah, we're ready.
All right, let's start with this one. It is a myth or fact. Burn wounds can be treated with toothpaste. Let me just say, my mom used to do this when I was little.
God, I think it's
every time I burned my
like
finger or something.
Tale, right?
Right? That's what mothers always say.
We just go with
Put a
myth.
toothpaste on.
Because whenever I go to the skin doctor, they never recommend this, the toothpaste.
Toothpaste, no.
Yeah,
So is it a myth or a fact, Dr. Randy?
It's a myth. Yes, no, don't use a toothpaste because as you know, toothpaste is a paste, right? It will have some detergent on it. So it will cause an abrasive reactions of the burn and may get worse. So it might cold because they have menthol and everything else.
Just soothe it a little bit.
Just soothe it a little bit and then the wound will get worse actually, so don't do it please.
So what is actually the right treatment for burn wounds?
So if you have a burn wounds, you have to take a clean water, maybe prefer to be mineral water that's sterile, and just,
wash it?
Run it over for like 5 to 10 minutes and bring over to the ER. Because the doctor needs to find out how deep was the burn. And it's differently. It's different how to manage it.
Right.
So it's
Depends
not
on the depth.
treatable at home.
No, it's not treatable.
Somehow.
So we're not telling you not to listen to your mom, but when she says this, don't listen. Go to a doctor, okay?
Toothpaste is just for teeth, all right?
Number 2, let's move on. Moisturizer is unnecessary for oily skin. I have a little oily skin. I've heard this before, but I'm not
I
sure.
still use moisturizer, even though I have oily skin, but I don't know whether it's a myth or fact.
I
but-
think,
so I'll go with
I
myth.
think it's a myth.
Yeah.
I guess.
Water and oil doesn't match, right?
Yeah, I guess.
Yeah, so what about
So,
you?
what is
do you
it,
think?
doctor?
So moisture is actually necessary, so it's right. It's a myth.
It's a
right?
myth.
So because even an oily skin needs a moisturizer because our skin, if they get dried, our skin tends to pump out more sebaceous and oil to our skin and getting more oily.
Oh.
Gets even oilier.
So it gets even oily. So the thing is, you should find the moisturizer that's comfortable for the oily skin.
Yeah.
Yeah, you can find it. The one that coming from lotions, gel,
Or cream.
and have
Lotion or gel?
because cream is not really.
thick.
It's too thick for the oily skin.
So let me rephrase that, Doc. If you have oily skin and you leave your skin unmoisturized, it would produce even more oil.
Oily.
Yes,
You
it
get
will
more
produce
oily.
More oily.
Well,
so-
it's quite
Okay.
productive if you want to produce some oil. But no, not on your skin. No.
Let's not do that. All right, so we have one more, doctor.
okay.
Here it is. Hot water showers can lead to skin dehydration. Oh, please,
Is it?
please don't.
It can get makes
No.
It
so
can be.
Really?
I like hot showers.
dry.
Really?
How's it
Yeah,
gonna be?
because the pores will be open and it's like steamed out. I mean, like, I don't know, evaporate somehow.
So
That's
is
my theory. I'm not a doctor.
Okay,
Is it a fact?
it's a myth because I've been in hot showers every time I go back from work.
Yeah.
Me too. I get so adamant about that. But I don't know. What do you think, Doc?
So actually, it's both myth and fact because it needs to be underlined that if you use the hot waters, it is true that it will make your skin more dry.
Right.
But only if you use the hot water in a very long period of time. So probably you soak yourself too long inside your bathtub, listening to sad song and crying, then it will make your skin dehydration. But if you just like doing for 5-10 minutes and the hot water
broken
is
heart
not,
people may
yeah,
have
you know,
because
I don't know. Just
they
is
forget
that just
how
me?
long they do that?
Well, you won. Okay, no.
So what's the recommended duration?
So at least, don't get it too long. If you do
Okay.
the hot water soak, you
Yeah.
don't take it too long, like 5 to 10 minutes only.
Okay.
And then don't get the water too hot because the rise of temperature is, actually related to the loss of the moisture of the skin.
Okay, so do not call your friend and gossip while you are
Yes,
inside
probably
the hot
like
tub.
that because hello,
Yeah, hello.
how's about this neighbor? Your
gossip
friend?
never
ends.
Gossip never ends.
It is the best, though. you
Hot
know?
tub. Yeah,
Hot tub
I
is
have
the
to
best,
agree with
right?
you.
Only for 10 minutes, please.
Only for 10 minutes.
No longer than that.
So for Dr.
Yeah.
Randy, do you have any, I guess, again, for the last one, tips or prevention?
Or probably message for,
the
our viewers at the moment
Yes.
About monkeypox.
Okay, about the monkeypox, the viewers doesn't need to be scared or even,
Alarmed.
panic, but only just cautious, I think.
Yeah.
So if you have a fever, if you have a vesicles, you have a close contact with your friends who have confirmed positively PCR for the monkeypox, go to the dermatovenerologist, ask the doctor, collect all the data as much as possible, and note yourself whether you get a monkeypox or not, because it's actually treated, and it is less likely to becoming outbreak pandemic like a COVID. So we don't have to worry because our competent health workers are fighting our best to make sure that it is under
treatable
control.
and we have to make it stop so it doesn't get
Yes.
the larger
And
communities.
let's say you are scared about the scar after the 2 to
Do some
4
laser
weeks.
treatment.
Do some laser, come
Yeah,
on.
just come to my practice.
Yeah,
I
you
can give you
can
a
come to
CO2
Dr. Randy's
laser
practice,
or a
or
laser.
you can have my doctor's number, the clinic.
Okay, thank you so much,
Okay.
Thank you, Doc.
Welcome.
And you know,
I hope
he's
it
a
helps.
familiar face here at the 3
Of
Hours.
Yeah.
So we're
course.
pretty sure we're going to see you again next time.
Yes.
Right?
With a different color of hair, George.
That's right.
Just tell me the colors. I will
Oh, wow. Okay.
found out the colors
That's
you
cool.
are.
All right. Thank you so much, Dr. Randy.
You're
and
welcome.
See the Stories will continue after the break. Stay with us. Don't go anywhere.